Here are 3 different healthcare careers that I would have considered if I didn't want to go to medical school, but I still wanted to have a strong impact in direct patient care, make more than 6 figures, and also have a pretty flexible career with strong autonomy and pretty good work-life balance. And I think the third one will really surprise a lot of people, including current healthcare workers. The first one would be a respiratory therapist into an anesthesia assistant. So the foundational career would be respiratory therapy, and they work directly with doctors to diagnose and treat various respiratory and cardiopulmonary disorders. So they're the people that would be managing an ICU ventilator. They're also the people that provide asthma care and various breathing treatments. The average income of an RT is $80,000 to $100,000 per year, and to become an RT, you would do a 2 to 3 year RT training program that also includes clinical placements. After you work and gain experience as an RT for a couple of years, you can then apply to get additional training to become an AA or an anesthesia assistant. AAs work directly with doctors in the operating room, and typically how this works is an anesthesiologist will intubate a patient and the surgery will begin. Then the AA will take over the sedatives, the ventilator settings, and all the equipment until the end of the case. The average income of an AA is around $100,000 to $150,000 per year. The second career that I would strongly consider is becoming a nurse and evolving into a nurse practitioner. So most people have a pretty good understanding of what a nurse does, and there are multiple different routes to becoming a nurse, and you can make anywhere between $80,000 to $120,000 per year, sometimes even more if you pick up overtime or holiday shifts. If you work as a registered nurse in the ER or the ICU, you'll be exposed to a wide variety of different clinical cases, and this will set you up really nicely to apply for additional training to become a nurse practitioner, which is typically a 2-year training program. Nurse practitioners or NPs can have quite a broad spectrum of practice, and they can either work independently or alongside doctors inside the hospital. So for example, some NPs will do the role of a family doctor, so they'll have their own patient roster, they'll be seeing patients and their families in the community, and they'll have the ability to prescribe medications and order things like x-rays and CT scans. The average income of an NP is $100,000 to $150,000 per year. And the third career that I would consider is a cardiac perfusionist. So what they typically do is they operate and manage the cardiopulmonary bypass machines during cardiac surgeries, which is a pretty wild job because oftentimes what a cardiac surgeon will do is they'll give a medication to stop a patient's heart from beating, and will rely on these machines to push oxygenated blood forward to vital organs during that surgery. The average income of a cardiac perfusionist is somewhere between $100,000 and $160,000 per year, and to become this, you would already be working and trained as a respiratory therapist or as a registered nurse, and then you would apply to a master's level perfusionist program, which typically takes about 2 years. And if you think that there's a healthcare career that I missed, drop it in the comments.